Okay, we're going to pick up with Chapter 7, Lecture Video B, and we're going to start with the hyoid bone, which is a bone by itself, really. It's grouped with the skull because of its proximity, but it doesn't articulate with any skull bone or any other bone for that matter. It kind of has a C or a U shaped. It's right at the superior part of your neck. It is suspended by two large ligaments that attach it to the styloid processes of your temporal bone, as well as your larynx, which is your voice box. The purpose here is to provide a place for muscles to attach. These muscles that are attaching here are very involved in swallowing and speech. So here is a picture of your hyoid, and again you can see there's the bone there, and then it's suspended by those two large ligaments right there. Okay, and you can see where it hits that styloid process of the temporal bone. Okay, so here's just the bone itself, and we have one of these in the drawer. You'll easily be able to spot the hyoid. Okay, so that gets us to the vertebral column, which is also called your spine. We have 33 bones here, and these 33 bones are called vertebrae. Now, vertebrae are classified based on their location and their structure, and so we have a naming system that we use. Each individual vertebrae is given a letter. That letter is going to signify its region, and it's given a number which will indicate its position. And so we'll go through this as we go through the different classes. There are spaces between the movable vertebrae called intervertebral foramen. They can be seen if you look at it from a lateral view. There are also spinal nerve roots that have to pass through these foramen. Alright, so here's your classification. You have 7 cervical vertebrae. These are located in the neck. For example, how we do that naming system with the letter and the number, if you had the 4th cervical vertebrae, it would be called C4. Alright, C telling you that it's in the cervical region, and 4 telling you that it's number 4 in that region. You have 12 thoracic. Thoracic vertebrae articulate with the ribs, so they're your upper chest. For example, the 11th thoracic vertebrae would be T11. Again, we're just kind of giving you some examples here. And then you have the 5 lumbar, which is your lower back. If you had 3rd lumbar, it would be L3. If you had the 2nd one, you would call it L2. The next 2 are fused bones. You have 5 vertebrae that have fused together, and they are in the sacral region. We collectively call this bone the sacrum, and it articulates with your 2 pelvic bones. And then you have the coccygeal region, which is between 3 and 5 fused vertebrae. We collectively call this the coccyx. You probably know this as your tailbone. It's at the very bottom or the more inferior end of your vertebral column. So when we talk about this, we like to bring up spinal curvatures. The C-shaped vertebral column of newborns eventually develops into an S-shaped secondary curvature as a baby grows up. You've all seen a newborn baby, and their backbone almost takes on a C shape. Well, that's what we call the primary curvature. That is, the thoracic region is curved, and the sacral region. And those are already present during that fetal development period. Alright? Then later, as the baby is able to hold its head up, as they can sit up and stand and walk, the secondary curvatures start developing. And this would be your cervical, which is the neck, and your lower back, the lumbar. And of course, they're going to develop after that fetal period. The development of the secondary curvature is critical in order to be able to walk upright. The cervical, of course, allows you to hold your head up. The lumbar shifts your weight into the sacrum. It also lends balance and support that you need in order to be able to walk on 2 legs. That is another example of that structure-function core principle. So this is a nice image, an overview of the column. You can see here's your cervical curvature. Your thoracic goes more out to that C-shaped, and then your lumbar comes back in, and then the sacral and coccyx are going to take it back out. Alright, so again, your C-shape, your thoracic and sacral are primary, and then cervical and lumbar are the secondary curvatures. You also sometimes have some abnormal spinal curvatures. Everyone, you probably have heard of scoliosis. That's an abnormal lateral curvature in the column. Lordosis, which is sometimes called swayback, is when you have an exaggerated either cervical or lumbar curvature. And then kyphosis is also called hunchback, and that's when you have the exaggeration of the thoracic curvature, and then of course it kind of gives you that hunchback appearance. And here are some nice images. This first one here, you can see the lateral curvature there. That's the scoliosis. This would be lordosis. This is a sway back. And then kyphosis would give you your exaggerated thoracic curvature there. All right, so let's look at the structure of the vertebrae. All vertebrae have these following features in common. They reflect the functions of the spinal cord protection, and of course they help support the head and neck. So all of them are going to have a body, or sometimes it's called a centrum. This is the weight-bearing surface. It is also the most anterior part of the vertebrae. The intervertebral discs are found between the bodies that absorb shock of running and jumping. You also have vertebral foramen, which are right behind the body. They're right posterior to the body. They're large openings. This is where the spinal cord and any tissues have to travel. All of the foramina form together, and that's what we call the vertebral canal. Most of them have two pedicles that border that vertebral foramen laterally, and they are going to project posteriorly from the body, which is pointing backwards. They merge with the laminae, which border that foramen, and then together the pedicles and the laminae form a vertebral arch, and you'll be able to see that really well when you look at a picture. There's also a deep inferior vertebral notch that's found on the bottom side of each pedicle. There's also a superior vertebral notch, which is found on the top or the superior side. Together, these notches form the intervertebral foramina, okay, which is a nice opening in the vertebrae. You have articular processes. You have both superior and inferior. This is at the junction for the pedicle and the lamina. The facets on the processes are able to form joints with each successive vertebrae. Transverse processes are pieces that stick out the lateral sides of the arch. They allow for muscle attachment. And you have spinous processes, which is going to stick out the back or the most posterior aspect. This also provides a site for muscles. This is the part you can feel. When you rub your finger down someone's spine, this is what you feel is the spinous process. All right, so let's try to put all that together because I know that was a lot. If we look here first at this is a typical thoracic vertebrae. So we'll look at the top. This is a superior view here. Here's the body. All right, that's the weight-bearing portion. Here is your vertebral foramen. Anytime you hear foramen, you know it's an opening. All right, this is where the spinal cord comes through. Do you see this long part sticking out the back? That's the spinous process. These two sticking out the side, that's the transverse process. This is the pedicle, all right here is your pedicle. You have one on each side, and here is the lamina. All right, so lamina right there, and then there's your pedicle. This is the superior articular processes, and then your inferior processes would be on the bottom, which we can't see from here because we're looking at from superficial view. All right, so if you look at it on a lateral view, you can still see the body really nice, and of course you can see how the spinal cord fits down into that vertebral foramen. You can see the spinous processes are kind of pointed downward there. You can see the facets of those superior and inferior facets these are how the vertebrae are going to join together. Here's a transverse process sticking out the back. These would be your other transverse processes right there. Okay, your inferior vertebral notch and your superior vertebral notch. Okay, so you can see those really nice. Of course, it shows the disc. That's your cartilage, that fibrocartilage there. And then, of course, it shows the intervertebral foramen, which again is that opening where the spinal cord passes through. So this is a comparison of a cervical, a thoracic, and a lumbar. You do have to know the difference. The cervical are much smaller. Their body is smaller, and the vertebral foramen is usually kind of like a triangular shaped there. Most of the spinous processes are fork or bifid shaped. C1 doesn't have a spinous process at all. It's shaped a little bit differently than the others. This is your typical thoracic. It's a little bit larger, kind of has a heart shape. The vertebral foramen is circular. They have long articular facets for the ribs, and they also have a pretty long process that points downward. And then you have the lumbar, which is really large. It's kind of a kidney shaped, but the body is really, really big. The foramen is a triangular shape. The transverse processes is really short. It doesn't have any facets, and the spinous process is really thick and blunt, like it's almost a straight cut off. So when you put these side by side, you'll easily be able to tell the difference in the three. Then that gets us to our sacrum, which is our 5 sacral bones fused together. And you can see this whole from here up is the sacrum. You have the base here. You have the apex down here. You have these transverse lines. That's where the joints, that's where the fusing happened between these bones. Of course, you have the openings. You have the sacral foramina there. All right, so you can see that. If you look at the back side of the posterior valve, you can see the sacral crest. This is the medium sacral crest. All right, and of course, you got some articular processes there to fuse with your other vertebrae. All right, so we'll study boost. How do you remember the bones and the vertebrae? Here are some tricks that will help you remember it. The 6 cranial bones we call the pest of 6. So that helps you remember the order: parietal, ethmoid, sphenoid, temporal, occipital, and frontal. All right. Next, you have the facial bones. Virgil is now making my pet zebra laugh. Vollmar, inferior nasal conch, nasal, mandible, maxilla, palatine, zygomatic, and lacrimal. And then you have every student fancies learning zillions more parts, and that's your orbit, bones of the orbit, which is the opening, the ethmoid, sphenoid, frontal, lacrimal, zygomatic, maxilla, and palatine. So maybe those little mnemonics can help you remember the different bones and what area they're in. For the vertebrae, we have some tricks to help you remember the numbers. Breakfast at 7. Because there's 7 cervical, it's at the top, breakfast comes first. Lunch at 12, 12 thoracic, and dinner at 5, the 5 lumbar. So that can maybe help you remember the types there. Some visual analogies. The sphenoid bone looks kind of like a bat. It has wings. The ethmoid is sort of like an iceberg, only its tip, the crista gallia, is visible. The thoracic vertebrae kind of look like the head of a giraffe. Think thoracic, giraffe maybe. And then the lumbar resembles the head of a lumbering moose. All right, and again, it's pretty large. And that maybe will help you remember lumbar. So here's some of those analogies. Here's your sphenoid. It kind of, again, looks like a bat with wings. The thoracic vertebrae looks like a giraffe's head. And then your lumbering moose here, all right, would be your lumbar. Right. All right, so let's talk about those intervertebral discs. You have 23 total. This is the fibrocartilage pad that's in between the bodies of all the adjacent vertebrae. Of course, we've already talked about this when we did tissue. It absorbs the shock, it binds the column together, but each disc has these components. The nucleus pulposus, which is a soft jelly-like substance. It's on the inside, and it's a really good shock absorber. And then you have the annulus fibrosus, which is the outer ring of cartilage that contains that nucleus pulposus, and it joins the vertebrae together. And here's a picture. The inner is the nucleus pulposus. This is the jelly-like, and then you have the fibrocartilage ring, that's just the annulus fibrosus, and that's more of the tougher part. Okay, we're going to stop here, and we will pick up with thoracic cage and the appendicular in the next video.